Live.
Oh.
Hi, everybody. Welcome to another one of our great Facebook Lives, actually on YouTube and several other places as well, as an opportunity to meet and greet some speakers that are going to be at our virtual event that's coming up this April. I'm Leslyn Keith. I'm with the Lipidemia Project. I'm the president of the board and director of research. And today, I am privileged to be joined here by AnnMarie DiAngelo, who is a member of our Lipidemia tribe and is going to be one of the speakers at our event coming up in April. That's our heart-to-heart 3-day virtual Lipidemia conference about keto. I always forget the title that it is. It is Keto and Beyond, Customizing Your Plan to Joyful Nutrition, which is, we're really going to be looking at the holistic aspect of nutrition, everything about, the social and all kinds of aspects of nutrition. And one thing that we're doing is that we have people who have lipedema that are going to be on a panel and talking about their experiences. And so AnnMarie is one of those people who's a very active person in the community. AnnMarie, thank you so much for joining me today.
Thank you for having me, Leslyn.
And you are actually an experienced person from that's going to be at this event, because you've also done in the past, you've been what we call a heart guide. You helped out at the event doing that. Can you tell everybody a little bit what that means to be a heart guide?
So we're kind of there as a resource. It was a great experience. We're there to lend support and encouragement to the community. And, we go into the rooms when we do the breakout rooms. And we're there to just help facilitate the conversation and be there as support, any questions or concerns or anything we can do to help, people get the best experience out of the event. And it was really wonderful to be part of that.
Wow. And thank you for doing that again. Because especially for people that this might be their first event, and they might need some support in order to get, like you say, the best they can out of the event, get the most ability to get their thoughts out there and to be able to collaborate and communicate with other people. So it's such a valuable thing that you're doing with that. And it's intense, you're out there supporting people and the people that are probably been through a similar journey as yourself, because AnnMarie, you have lipedema yourself.
Yes, I do.
When did you tell me a little bit about, when did you figure out this was going on, or what I should say more of, when did you notice that there was something different about you?
Leslyn, when I think back, I now know, like they say, from puberty, I look back at pictures and I can vividly remember my legs never looked normal. I, danced for many years in a lot of different classes I took, and cheerleading, exercised my whole life.
Mm-hmm.
And, I had a much smaller upper body, completely out of proportion to my lower body. Even when I lose weight, it would all come, people say, oh, your face is so thin, or my upper body. And yet it wouldn't barely touch the lower half. So they never toned. And I saw every doctor, every type of specialist known to man, even including several vascular. No one ever knew what was going on,
Well, this was happening in puberty, actually, a time that most girls feel pretty vulnerable and are trying to fit in.
Right.
And then how long did it take from knowing something was different about you and not knowing what to do about it until you learned about lipedema?
It took several decades.
Wow.
Several decades to get the diagnosis. My diagnosis is not that long ago, actually. It was June of 2021 when I got the official diagnosis.
Wow.
And I kind of happened to see this doctor almost by accident, in a sense. I went with my daughter for an issue she was having and really liked him. And he was an interventional vascular doctor, and made an appointment. And soon as he took one look at me, he said, "You have classic lipedema." He said, you know, it cuts right off at the ankle, your edema. And he couldn't officially diagnose me. It wasn't really
it wasn't your appointment. Yeah.
Well, you know, it was, he said, "I know you have it, but I have to send you, you know, I had to go even out of the health system."
Wow.
Into
but
that he was in.
That's unusual, you know, to have someone that takes one look at you and knows.
Yeah, after seeing countless specialists over the years. He was my angel, I say, like that I finally got to the right person.
Yes.
And that's what brought me actually to Dr. Zhang at University of Penn. I've had her treating me, and she diagnosed me, who was Catherine's doctor, and she's amazing.
Tell me what that was like for you to all of a sudden have this diagnosis after not knowing for decades what was going on. What was that like?
It was scary in a sense to have a name, but then again, it was finally, you know, I knew I had so many vague symptoms, like all this pain and swelling and just so many different things going on, the fatigue. And like I said, it was frustrating because I'm one of these people, I love exercising. It's one of my favorite things to do. And, you know, even a critical care nurse in the hospital, and I had to leave that position a couple years ago and go to outpatient, ambulatory nursing, because it was very hard on my body and I didn't know what was going on. I was just attributing it to the, to the nursing, like all the heavy lifting, pushing patients and being on my feet. And I just thought that, I gotta, be better, even exercise more, or, constantly thinking like, I have to do more. So I finally knew once I got the diagnosis that it wasn't my fault. That was the biggest thing that hit home, is that I could stop feeling guilty that it wasn't obesity while I was gaining the weight.
Right.
And like we've talked about, there's true measurements, with the waist to hip ratio, and all that. And it proved that. And I finally found like I was heard, because I felt like no one was listening. I had knee surgery from an injury back in September. Well, it was November of 2020. This is before my diagnosis. And the orthopedic surgeons, they couldn't figure out what was all this swelling. Like after the surgery, they're like, this doesn't make any sense.
Yes. Why do you have so much post-surgical swelling?
Right.
Yeah.
But once I got the diagnosis, so many things fell into place, and I was able to then be, to get a treatment plan together, and, to know which direction I needed to go in. So I felt like empowered that I had, all of those tools, thanks to Lipidemia Simplified, who has been, I say it's my lifeline, because finding this support group has just changed my life in terms of dealing with this, and all the education that comes with it, and being a nurse and loving research. And I just love everything about it. I love the community. We're all like-minded individuals. We have this common thread, and, we support each other in a way that the outside community can't do. for us. Like they can know about it, but all of us together, like I feel like I'm understood here.
Yes.
I have all the resources that I could ask for, and it's it's comprehensive. It's all in one place. So
and it's you don't have to explain yourself first. People
right.
all know where you're starting from. You
Yeah.
can go right to, now this is the aspect, this is the detail that I want to talk about and see what other people think. But you don't have to do all of that introductory explanation because everybody in the community knows.
It's wonderful. And not only does it help you with the physical aspects of the disease, the emotional aspect of the disease, like we all feel that same emotional pain as well as the physical pains. We know how, that almost like the loss of control of your body. You see it, things happening to it. And it's not for the lack of trying, but it's, the disease process, but there is a lot that we can do for it. We know that now.
Right.
So we're constantly learning about that, but we can support each other in the way we're feeling.
Yeah, and I think that the mental health side of a chronic condition is not always looked at. When you go see, even if you were able to find a health practitioner who understands lipedema, they're going to usually really focus on the physical aspects of it. And there's so much more in what we get from Lipidemia Simplified and these virtual events, is that we're looking at the emotional, the psychological, the mental, the social, all of these aspects.
There's so many components. There's so many components of it. And even, everyone has been great to learn from, all the researchers and all the presenters, but like hearing Dr. Raymond Perrin with, teach us about the lymphatics. And I've long since said, like, that it's affecting different things, like, say cognitively, neurologically, in all those ways. But no one ever explained that part of it. And the way he's broken it down for us, that we, at least, like, I know it's part of this disease process. So it helps you to put things in perspective.
Right.
So it's that, even that part's been so helpful.
And I think that, and this as in being in nursing, that people wonder about all the other things they have going on that they might be experiencing, maybe some hypothyroidism or some hypermobility, hyperflexibility, maybe it's Ehlers-Danlos syndrome. And then when you come into a community like this, you find out that, a lot of other people with lipedema also are experiencing these other things that maybe it's part of lipedema, or it just seems like these conditions kind of cluster together. And you might have been compartmentalizing and thinking, this is something separate, but we are just one body. And so these things all interact, and we're finding that some things are more common than others. And so it's to be able to come in a community and learn about that too, that, while I'm managing my lipedema, I also can work on these other things going on with me as other people in the community are doing. Right.
And like I mentioned, I have my sister's 10 years older, and we know that she has it. And she's, almost wheelchair bound. It empowers me to help her too, because she can't, like do the things as much, hers is more progressed. And so by helping myself and learning through, Lipidemia Simplified has helped me to help her.
Yes.
And other women that could maybe have it, to recognize it in others, even in my career, seeing different people. And
you're in the healthcare field. And so you are raising the awareness of among just the people that we need to have their awareness raised.
Right. Right. Like I'm trying to.
You educate one doctor or one nurse, and that's probably helping thousands of
right.
Yeah.
And that's what I've been trying to do. And even different, specialists that I've been to, such as orthopedics, who literally told me we had no clue. They're like, we have never, ever heard of this disease. You're teaching us. They literally had their residents sitting down and looking up the disease while I was sitting there with, he's like, you're helping us to learn about this because we had no clue. And I do feel so motivated to like raise that awareness. I feel like it's, God's purpose. I have a lot of faith, and I feel like we have to get the word out and help the women. Yes. If I could help one woman to not have to go through several decades before she got an answer and seeing it progress and not knowing what's happening to her body, but knowing that she has all these symptoms, I feel like there's no limit to what I'll do to like spread that awareness. Even in my own health system, I'm, trying to raise that awareness that we've got to do something. This is not, it's 11% of our female population. This is not a little bit of people,
Right. And you're doing that by being part of this event in April, not only as being part of a panel to share some of your experiences as a patient with lipedema, but also to be that support for people who are coming to the event, maybe for the first time, maybe it's not the first time, but to have that extra support of a heart guide is so beneficial to our participants. Please take a look down below, and there's more information. There's a link to our 3-day event. It's April 12, 13, and 14. It's virtual, so you can join us anywhere around the world. And it is, the event takes place at Eastern time, which is good for you because you're in the Eastern time zone, AnnMarie. But if you are some other time zone and it's not at a good time for you, remember they're for a premium membership or a premium registration. You can get all the replays, so you can watch them when it's it's not in the middle of the night for you. And even if you are there for the whole time for this virtual conference, to have those replays and be able to rewatch some stuff. Sometimes when you're watching it for the first time, and let me know if this happened to you, AnnMarie, you get kind of so emotional that you miss stuff.
Yeah, so true.
And it's good to be able to watch it. Yeah.
Yes, yeah. I definitely like, taking my time again and revisiting it and writing notes more and
to process it all.
Just taking it all in. Yeah, process it. Yeah.
We do have also a calendar for events. This is Lipedema Simplified, a calendar of events that has all of our Facebook Lives, all of our free webinars, and this 3-day event also is on that calendar. And so anything you missed, so like we've already had 2 other speakers be on a live earlier today. And if you missed it, you can click on that calendar and you can watch the ones that you might have missed, and you can see what's coming up on our calendar. So you can see the link right there, and that will be down below. Definitely come to our event in April and meet AnnMarie. Be in a small breakout room with AnnMarie and learn about her and her experiences, and she will listen to yours. Yes. I think this is going to be a wonderful event. And AnnMarie, I can't thank you enough for being part of it. I think that you are making it even more special.
Thank you, Leslyn. It's an honor. It's an honor to give back to this, support group. All that Catherine did, it's the least I can do. She's given me and all of you priceless knowledge and support. So I'll do anything to help others and all of you, because
thank you so much.
Eternally grateful.
And we're grateful for you.
Thank you.
So thank you, everybody, for being here with us today. Be sure and register for the event, and we hope to see you there. Thank you for being here, everybody. Bye-bye.
Take care.